inaugural DHA graduating class, to the extraordinary faculty who teach in the program, to the exceptional staff in the MSM Online Division. My name is David Hefner, and I have been given the honor of leading and growing MSM's online and continuing education portfolio, giving it the form and function it needs for global scale. I have served at MSM for 10 years as Chief of Staff to the President and CEO, and then Vice President and Chief Strategy Officer, leading transformational growth at MSM for the last 10 years. Almost 50 years ago, in 1975, MSM was founded and enrolled its first MD class of 22 students in 1978. 13 years later, in 1991, we launched our PhD program and graduated our first PhD students in 1988. Almost 25 years later, MSM launched its third doctoral degree program, the Doctor of Healthcare Administration degree. In this cohort, each of you of 12 will graduate May 17th, 2025, pending a successful capstone presentation in the historical inaugural class of DHA graduates. I want each of you to understand the history and legacy that you will carry and to some extent bear. So each of you has already achieved significant accolades. There are even higher expectations that come with having a degree from Morehouse School of Medicine. And yet, you did not come this far to disappoint. Indeed, you were chosen for such a time as this. As administrators, our job is to solve problems so that the business of education, patient care, health care, and wellness can ensue. Our job is to serve in excellence, regardless of who gets the credit. At times, it's to make a way out of no way at all. This historic inaugural class, I salute you and affirm that you all will be ready. Congratulations, and I look forward to meeting each of you in May. Thank you.
Good evening, everyone, and welcome to this evening's Spring 2025 Doctor of Health Administration Capstone Oral Presentations. I am Renetta Waldrop, Associate Professor and Inaugural Program Director for the DHA program, also currently serving as an Interim Dean for Online Education and Expanded Programs. Tonight, our Cohort 1 scholars who entered the DHA program in the fall of 2022 will complete their last assignment and presentation of their 3-year doctoral journey. Their culminating project, a solution-focused capstone, will showcase their ability to identify a problem related to healthcare and to research and recommend a solution that is industry feasible, patient-centered, and administratively sound. Tonight, in TED Talk style, you will hear only a fraction of their research, a compelling story that sets the stage for the problem itself, a statement of the problem and its magnitude, what the literature has revealed to our scholars, and their recommended solution. For those of you wanting to learn more, their full capstone research project in the form of a white paper will be made available in a digital repository through the MSM library. I want to thank Mr. Swanson Dr. Lynn Simpson, and Dr. Roland Wellmaker for making this option available for our scholars. I also want to thank all of our faculty and OEEP staff who supported our scholars, and in particular, those faculty who served as Capstone coaches, guiding our scholars to this final stage of their journey, as well as their subject matter experts who provided industry-relevant advice. I also want to thank Ms. Blake Crosby for making this virtual presentation platform possible tonight. Tonight's presenting scholars are Capri Alford, who will be followed by Leah Rowe, who will be followed by Lynn Johnson-Reed. The audience will be able to enter any questions for our presenters in the chat. Following the last presentation, questions will be fielded by Dr. David Miles. Q&A will be followed by Dr. Dorothy Boldrick, Doctor of Health Administration, Assistant Professor, who has been with this cohort. She has been with this cohort since day one. And believe it or not, that was a mere 934 days ago. Seems like yesterday. But she will give our closing remarks. I want to thank you all for being here and for your support of our DHA scholars. Ms. Alford, your TED Talk audience awaits, and the virtual TED Talk stage is yours. Thank you.
Hello, my name is Capri Alford, and this evening I'll be discussing an evolving multi-generational workforce, strategies to foster engagement, harmony, and a sense of belonging. Take a moment. Examine the images before you. To the left, you see nurses hard at work, dedicated, compassionate, and driven. At the center, my mother, a charge nurse, a leader, a mentor. For years, she has not only excelled in acute care, long-term care, clinical education, and leadership, but has also left a lasting impact in the field of nursing itself. Now notice the faces around her in blue. Novice nurses just beginning their journeys. They stand eager, hopeful, and ready to learn. And my mother, she's there, offering her wisdom, her expertise, and her passion. Now to the right, you see something extraordinary. The innovation, the science, the progress we can achieve when tenured experience and fresh perspectives collide in perfect harmony. When knowledge is shared across generations, something remarkable happens. A culture of collaboration, one of inclusion and growth. Now imagine a world where seasoned nurses with decades of invaluable experience feel not only respected, but supported every step of their careers. A world where they pass down their deep well of knowledge, while in turn learning from the next generation. Their fresh ideas, their tech savviness, their new ways of thinking. And picture the impact. Oh, what an impact. Lower burnout, higher retention, and most importantly, an energized, engaged workforce delivering even better patient care. Now, this is not a dream. This is the future we can create. And the key to unlocking it lies in each and every one of us. So let's dive in and let's explore what it takes to build this reality together. So today, our workforce spans 5 generations with a 6th on the horizon. In our workforce today, we have traditionalists, also known as the silent generation, baby boomers, Generation X, millennials, and Gen Z. With that, we have a generational spread with individuals working in our workforce in their teens to upwards of their 80s. And our workforce size, millennials make up the largest generational cohort in our workforce today, making up 38.6%. And future projections. So by 2034, millennials, Gen Z, and first generation alphas will make up 80% of the workforce in advanced economies. Yet and still, there is a readiness gap. While 70% of organizations consider leading multi-generational workforces extremely important, only 10% feel ready to address this trend. Because never before have we had such a vast spectrum of experience, insight, and skill sets working side by side. Yet despite this incredible opportunity, many organizations struggle with the readiness gap, as well as the ability to bridge generational gaps. So think about it. In your own workplaces, do employees of different generations truly collaborate? Do they support and learn from each other? Or are there silos and stereotypes and misunderstandings that show up and create more tension and disconnects? Well, here's the reality. When we fail to connect across generations, we miss out on a wealth of knowledge, innovation, and productivity. But when we get it right, we create an environment that is engaging, fulfilling, and transformative for both employees and patients alike. So now that we've discussed our workforce today, let's take a deeper look into the generations within our workforce and how to effectively manage them. So picture Tom, a traditionalist and retired nurse who still volunteers at the hospital. His decades of experience make him invaluable as a mentor, offering wisdom and steady guidance. He values respect, structure, and loyalty, which shape his approach to work. So when managing a traditionalist, it's so important that we recognize their wealth of knowledge and experience, while also providing opportunities for mentorship and knowledge sharing. Now meet Jane, a baby boomer, dedicated nurse of 35 years of experience. She takes pride in her commitment to patient care and values job security. Her work ethic is unmatched. She strives on being recognized for her loyalty and contributions. So it's important when managing a baby boomer that we respect their need for job security and stability, while also recognizing their contributions and loyalty. Now imagine Lisa, a Gen Xer, a mid-career nurse manager, juggling work and family life. She values autonomy and efficiency, preferring direct communication and results-driven leadership. She's adaptable and eager for leadership opportunities, but expects work-life balance. So it's so important for Gen Xers that we provide space for work-life balance, while also recognizing their experience and expertise, and offering opportunities for leadership and career growth. Now think of Alex, a millennial and a nurse who embraces technology and thrives in team-based environments. He seeks flexibility, continuous learning, and clear career growth opportunities. He believes that mentorship and feedback are the keys to professional success. So when managing a millennial, it's important that we offer work arrangements that are remote and provide flexibility, while also providing opportunities for professional development and mentorship. And last but most certainly not least, meet Jordan, a Gen Zer, a newly graduated nurse eager to make a difference. Digital tools are second nature to her, and she values diversity, inclusion, and instant communication. She expects a collaborative workspace that prioritizes well-being and innovation. When managing a Gen Zer, it's so important that we offer opportunities for skill development and career advancement, while also embracing technology and digital tools around communication and collaboration. So how do we bridge these gaps? How do we transform a fragmented workforce into a dynamic, inclusive space? Well, it starts with these 4 steps. Step 1, identify the generational gap. To do so, we must first acknowledge that there are gaps and locate the gaps. This can happen by listening to the concerns and need of the different generations in our workforce. Step 2, we must adapt leadership and culture. A one-size-fits-all does not fit all. Leadership must be flexible enough to engage each generation in ways that resonate with them. Step 3, by creating a comprehensive engagement plan, whether it's a mentorship program, training opportunities, or flexible work arrangements. These intentional strategies create engagement. And step 4, by celebrating generational strengths, by understanding and embracing the value that each generation brings to the workforce, and then honor those contributions and create opportunities for cross-generational collaboration. So by understanding each generation's values, we can bridge gaps and foster a culture of collaboration. So once we've pinpointed the gaps, we can bridge them and build a healthcare workforce that is engaged, one that's skilled and committed to excellence. So how do we get there? Well, I'll tell you. Strategy one, it's important that we provide training and development. By offering programs on cultural competence, generational awareness, and inclusive leadership, we can enhance team understanding and appreciation. Strategy two, mentorships programs. By pairing employees from different generations together, we can begin bridging experience and innovation through collaboration and learning. And strategy three, by offering flexible work arrangements and recognizing that different generations do have different needs, be it remote work, phased retirement, or work-life balanced opportunities. But I bet you're wondering, well, what does that cost and is it feasible? Well, I'm glad you asked. Training costs on average are about $954 per employee. I know, it's a big number. But these costs do cover materials, trainers, and technology. While this is an investment, the cost of turnover for a nurse can be as high as $64,000 annually. So this is an investment in saving money on the front end. Training in development is not just feasible, it is truly essential, as it reduces turnover, fills skill gaps, and ensures top quality patient care. With mentorship programs, there are also low costs, which typically include mentor training, program management, and delivery. But the return on investment is undeniable because mentorship fosters growth, improves job satisfaction, and can cut turnover by up to 15%, making the strategy more than feasible. It's transformative. There are also costs associated with flexible work arrangements. However, adapting to employee needs, whether it be remote work, flexible schedules, or technology investments, it creates a happier, more productive workforce. This strategy isn't just feasible, it is truly the future of healthcare. So the bottom line is, investing in these strategies does not just benefit the employee, it improves patient outcomes and strengthens the entire health system. So the question isn't, can we afford to invest? The question is, can we afford not to? So as we bridge the gap, it is so crucial that we ensure every employee is heard, recognized, and valued. So bridging the gap requires enhancing communication and collaboration. And this can be achieved by cultivating a culture of regular feedback and recognition, as well as leveraging employee resource groups, also known as ERGs, to provide enhanced communication and valuable networking and support systems. By implementing these strategies, we foster greater engagement, satisfaction, and a thriving workplace, united by shared vision and purpose. Still wondering why employee engagement matters? Well, engagement is the heartbeat of any thriving workforce. When employees feel heard, valued, and connected, they stay, they innovate, and they give their best. And this can be done by ensuring they feel valued, motivated, and connected. Engagement is achieved when we align purpose and meaning to the work that we're asking our employees to do. We're saying thank you, we're recognizing them and appreciating them. We're creating growth and development opportunities while also creating space for autonomy and empowerment. Also acknowledging the need for work-life balance, creating positive work environments, and continuous feedback. Because engaged staff are happy staff, and happy staff love their jobs and stay. So employee engagement matters, and the data reveals just that. Employees that are engaged, they stay. Disengaged employees leave. It is that simple. We must note, however, healthcare in particular has faced unprecedented turnover post-pandemic, exposing critical gaps in healthcare engagement and retention, with the greatest decline in engagement experienced between 2021 and 2023. However, while engagement has improved since 2024, challenges still remain and there's work to be done around continually steady improving patient engagement and employee engagement. Engagement measures an employee's connection, satisfaction, intent to stay, and likelihood of recommending their employers to others. So our goal should always be to yield engaged or highly engaged employees. So the question is, how do we sustain employee engagement? Well, I'm glad you asked, and I'll tell you. We must engage and keep our employees engaged, especially our millennials, who make up the largest cohort in our workforce today, yet report the lowest in engagement scores of 3.89 out of 5 compared to their non-millennial peers. So to enhance millennial engagement, healthcare organizations should provide professional development opportunities, encourage open communication and feedback, provide flexibility and work-life balance, while also involving them in decision-making. So if we want to build a sustainable healthcare system, we must prioritize engagement for all generations at every level, from our entry level to our seasoned leaders. So let's talk a little bit more about our leaders. Leaders are important, wouldn't you say? What would an organization truly be without its leaders? However, here's the hard truth. Leadership engagement has declined and continues to decline year after year. And yet, leaders are the cornerstone of driving engagement across an organization. When leaders are not engaged, there is a decline in leadership motivation and guidance. Disengaged leaders further drive turnover for employees. So if leaders are important, like they should be, why don't we invest in them? When leaders are not invested in, their teams are not invested in. We must engage our leaders by investing in leadership training, support, and development to reverse this trend. By prioritizing leadership engagement, we build a strong foundation for success, ensuring leaders are equipped to guide their teams toward a brighter future. So now that we know the importance of employee engagement, let's discuss the impact of disengagement. So when we fail to engage, we disengage. It's simple. And the cost of disengagement is pricey. Employees who are disengaged from their work are twice as likely to leave than their highly engaged peers. So if we fail to address engagement, we will see declines in productivity and morale, decrease in customer satisfaction, failure to achieve company goals, as well as risk losing top talent and diminishing quality patient care. By prioritizing employee engagement, healthcare organizations can cultivate a more engaged, satisfied, and loyal workforce, leading to better patient care and long-term success. However, if we don't re-engage the disengaged employees we have, disengagement will lead to turnover. And turnover is a very costly problem, costing organizations $25 million annually, as it drains resources, increases HR costs, decreases profitability, and harms productivity and culture. In healthcare, 1 in 5 employees left their jobs between 2022 and 2023. These numbers were even greater among employees who have been in their organization for 2 years or less. But when we foster a culture of engagement and connection and purpose, we create loyalty, resilience, and a thriving workplace. So when we successfully engage a multi-generational workforce, the future is bright. By leveraging the diverse strengths and extensive experience of our teams, we cultivate a culture of collaboration that drives groundbreaking innovations and patient care. When different generations unite, their unique perspectives and collective expertise enhance treatments and streamline healthcare process, ultimately leading to superior patient outcomes. So the bottom line is prioritizing engagement from a multi-generational workforce not only advances care, but also transforms patient outcomes for the better. So let's recap. Engagement isn't just a goal, it is the driving force behind a thriving workforce. But here's the thing, engagement is not a checkbox. It's a commitment, a culture, a movement. When we truly engage, we empower employees through training and development. We nurture talent with mentorship programs by creating a culture of continuous growth. We grow by embracing flexible work arrangements and boosting satisfaction and retention. We develop adaptable workforces when we connect generations and spark collaboration. We guide the workforce of the future by creating a sense of belonging and shared purpose. But most importantly, we ignite enthusiasm because engaged employees, they don't just stay. They inspire, they innovate, they elevate everyone around them. So let's engage, 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 because the future truly depends on it. So the truth is, engaging a multi-generational workforce takes every single one of us, from our top executives to our leaders, from our most seasoned staff to our novice employees. We must remain united and committed to collaborating and embracing our unique attributes. So now I ask you, what role will you play in transforming your workforce? If you're a healthcare executive, what policies, programs, and resources will you implement to enhance and better support and engage a growing multi-generational workforce? If you're a leader, I want you to think about how you will drive meaningful change in your role into those who you supervise. If you're a seasoned professional like my mother, I want you to think about how you will mentor and support the next generation. If you're an emerging professional, how will you use your voice and advocate for collaboration and inclusion? Healthcare is not just about caring for and treating patients. It's about creating a thriving, engaged workforce that delivers exceptional care. Together, we can transform our workplaces into dynamic, supportive, engaging communities full of harmony and a sense of belonging, where every voice is valued, every voice is heard, and every individual is empowered to succeed. So let's be the change we want to see. Let's build a future where multi-generational collaboration is not just encouraged, it is the foundation of who we are and everything that we do. So I will close with this quote. If you want to see something happen, you must be part of the solution. So let's take the wise words of my pastor, Dr. William H. Robinson, and put them to action. At this time, I'd like to take a moment and extend thanks to those who have been solutions along my DHA journey. First and foremost, I'd like to extend my deepest gratitude to God. Thank you, God, my Lord and Savior. To Dr. Angelita Howard, thank you for your fearless leadership and vision. To my incredible cohort and esteemed DHA faculty, thank you for your guidance, wisdom, and support. A special thanks to Kim Bell for your leadership, expertise, and encouragement as my SME. Dr. Dodson, you have been more than a mentor and a capstone coach. You have been a constant source of motivation and support from day one. And for that, I am forever grateful. To my daughters, thank you for inspiring me to be the best version of myself, knowing that you are watching me. To my husband, thank you for standing beside me through every aspiration and achievement. And to my mother, my pillar of strength and inspiration, I dedicate this capstone to you in honor for your selflessness, leadership, and countless lives that you have touched. Thank you so much.
Greetings, everyone, and good evening. Thank you for being here tonight. My name is Leah Rowe, and the title of my capstone is Strengthening Arkansas's Older Population, a Unified Approach to Reducing Chronic Disease. We will be discussing how we can strengthen Arkansas's aging population in an effort to reduce the effects of chronic disease that plagues this great state. Before we begin, I would like to define a few terms that you will hear throughout the course of this presentation. So we have chronic disease, whole person care, integrated disease management, also known as IDM, as well as social determinants of health. Chronic disease. Chronic disease is a health condition that lasts for an extended period, typically more than 1 year, and requires ongoing medical attention. These conditions are characterized by durations, how long their duration is, medical management, the impact of daily life, and its non-curable nature. Common chronic diseases include heart disease, diabetes, cancer, arthritis, asthma, chronic disease, chronic kidney disease, and multiple sclerosis. We have whole person care. This concept emphasizes treating the whole individual rather than just focusing on specific diseases or conditions. Whole person care considers the physical, the mental, emotional, and social factors that affect a person's health. It aims to provide a comprehensive support that addresses all aspects of a person's well-being. And then we have integrated disease management. This is a comprehensive approach that combines medical treatment with lifestyle modifications, telehealth services, and social support to manage chronic disease effectively. IDM focuses on the whole patient rather than just an individual symptom, promoting better health outcomes through coordinated care. Then we have social determinants of health. These are conditions in which a person are born, they grow, they live, they work, and they age. These factors include socioeconomic status, education, neighborhoods, physical environment, employment, and social support networks. These determinants significantly influence health outcomes and contribute to health disparities. Now that we are familiar with those terms, let me introduce you to my friend Ruth, who will be our friend for the remainder of this presentation. Ruth is a 68-year-old woman. She lives alone in a small town in Arkansas. She is a very vibrant soul, known for her beautiful garden, her delicious homemade pies, and she shares them with her neighbors. But beneath her warm smile lies a daily struggle. Ruth has been battling with high blood pressure and diabetes for years. Each morning, she wakes up with the weight of her health condition pressing down on her. Every time she needs to see the doctor, she faces a daunting journey, a long drive to the nearest clinic, often with no one to accompany her. The waiting rooms are so crowded, and the hours spent waiting for her name to be called feel endless. These appointments are not just inconvenient, they are overwhelming. They are stressful, often leaving Ruth feeling anxious and isolated. Ruth's health issues have a profound impact on her daily life and her ability to serve her community. She used to volunteer at the local food bank, helping to distribute meals to those in need. But now, the physical toll of her condition makes it difficult for her to stand for long periods of time or lift heavy boxes. Her once vibrant garden, which served as a source of joy and connection with her neighbors, has become overgrown and hard for her to maintain. Weeds have overtaken it, and she finds herself unable to tend to it as she once did. So we have to ask ourselves, why should we even care about little old Lady Ruth? Because she's not just a statistic. She represents countless older adults in our communities who face similar challenges. When we neglect the health of individuals like Ruth, we are not just failing them, we are failing our communities, our families, and ultimately ourselves. Ruth's story is a reflection of a larger issue, an issue that affects the health and well-being of our aging population. So today, I want to talk about how we can change the narrative for people like Ruth, how we can address chronic disease for our older population, particularly here in the great state of Arkansas. Let's take a deeper dive into the stark reality of chronic disease. Chronic diseases like heart disease, diabetes, respiratory illness often affect millions of people. And they impact entire families in ways that goes beyond biology. The World Health Organization reports that chronic diseases are responsible for an astonishing 73% of annual global deaths. This statistic is by far a mirror of the reality that these diseases are more than avoidable and treatable, yet still they cause a death rate at a frightening scale. Chronic diseases account for 60% of the global disease burden, a metric that assesses the suffering of living with these diseases and the early deaths they cause. This burden falls on individuals, families, communities, and the healthcare system. In the US, the rate of chronic diseases is overwhelming. 6 in 10 adults have at least one chronic disease, and 4 in 10 adults have 2 or more chronic conditions. This is to say that almost all adults are juggling with multiple health problems, which isn't a recipe that adds up for great quality of life. So, why does all this matter about chronic disease? Chronic disease represents an immense burden on our healthcare system. The costs are particularly overwhelming. Chronic diseases make up for the largest portion of healthcare expenditures. In the United States, billions of dollars are spent annually to manage chronic disease in the healthcare system. Money that could otherwise be spent on preventative care and other essential services. Health disparities are made worse by chronic diseases. Specific populations, especially those with lower socioeconomic status, have higher chronic diseases related to poor nutrition, lack of physical exercise, lack of healthcare access, and limited physical activity. This creates a cycle of disadvantage that is hard for us to escape. So, I'm sure you are wondering, what is the fuss and the uproar about this demographic of individuals? The baby boomer generation, individuals born between 1946 and 1964, is rapidly aging. By 2030, all baby boomers will at least be 65 years old, resulting in approximately 73 million older adults in the US, nearly doubling the number from 2016. This demographic shift represents a profound transformation in our society. As the baby boomer population grows, so does the demand for healthcare services. Older adults typically require more medical attention, leading to increased healthcare costs. In fact, it's projected that by 2030, the US will spend over $1 trillion annually on healthcare for older adults alone. This surge in demand puts an immense pressure on our healthcare system and public resources. As this generation retires, there will be fewer workers contributing to Social Security and Medicare, which constrain these vital programs. The ratio of working individuals to retirees is shifting, meaning fewer people will be supporting a growing number of retirees. This imbalance threatens the sustainability, which are critical for the financial well-being of older adults. Baby boomers are not just the largest age group in the US, but they hold a sustainable portion of the nation's wealth. Their spending habits influence the economy significantly. As they age, their health needs will drive change in various sectors, including healthcare, housing, consumer goods. In Arkansas, this demographic shift is particularly impactful. The state has one of the highest proportions of older adults in the country, with 17.8% of the population already aged 65 and older. This means that the state of Arkansas is at the forefront of the challenges posed by an aging population. The financial strain on the Arkansas's healthcare system is already evident, with high rates of chronic disease. The state is grappling with the costs associated with managing these conditions among older adults. As the baby boomers enter retirement age, the demand for healthcare services will only increase, exacerbating existing challenges related to access and affordability. Arkansas's unique socioeconomic challenges, including high rates of poverty and limited access to healthcare in rural areas, this makes it even more critical to address the health of an aging population effectively. By investing in preventative care and integrated disease management, Arkansas can better prepare for the financial implications of this demographic shift while improving the quality of life for its older residents. As previously stated, chronic disease is costing us millions. It's costing us so much money. So, here we see that chronic disease is contributing to about 75% of the total healthcare spending in the United States, amounting to about $4.5 trillion annually. This staggering figure reflects not only the direct cost of medical care, such as hospital visits, medication, and treatment, but also indirect costs associated with lost productivity and diminished quality of life. Individuals suffering with chronic disease often face limitations in their activities, leading to absentees at work and decreased overall productivity. This loss extends beyond individuals, impacting employers and the economy at large. In Arkansas, The financial burden of chronic disease is particularly heavy as the state copes with high rates of conditions such as obesity, diabetes, and heart disease. Coronary heart disease is one of the largest killers in the state of Arkansas. These chronic diseases strain both the healthcare system and the economy, creating a cycle of increased healthcare costs and reduced economic output. For instance, managing chronic conditions like coronary heart disease and diabetes can lead to steep medical expenses. Hospitalization for these conditions can average around $15,000 each. This culmination of effect of these healthcare costs can be devastating, not only for individual families, but also for the state budget. As more resources are allocated to addressing chronic disease management, there are fewer funds available for critical areas such as education and infrastructure. This financial strain can lead to higher insurance premiums and taxes, further troubling residents. Looking ahead, the financial and economic impact of chronic disease is projected to escalate drastically. By 2030, the cost of chronic disease treatment is expected to reach an astonishing $42 million globally. This multifaceted challenge necessitates a comprehensive approach to prevention and management, emphasizing the importance of early intervention, lifestyle changes, and community support to alleviate the growing burden of chronic disease in Arkansas and across the nation. By addressing these issues proactively, we can not only improve healthcare outcomes, but also foster a more sustainable economic future, thus helping individuals like our dear friend Ruth. As we continue to dive into the issues of chronic disease affecting our older population, it is essential to recognize the proactive measures that are being taken to address these growing challenges. The literature highlights several effective approaches that have been adopted across the states and beyond. These current approaches found in literature include integrated disease management, telehealth services, community health workers, patient-centered medical homes, and behavioral interventions, social service integration, and community-based programs, education and outreach, along with the traditional approach of medication management focused on treating symptoms and the associated disabilities. For the sake of time, we will take a glance into a couple of the current approaches mentioned. We have patient-centered medical homes. This approach focuses on providing coordinated and comprehensive tailored care to individual patients' needs. This fosters strong relationships between the patients and their healthcare teams to deliver holistic care, whole person care, if you will. And then we also have community-based programs. These programs engage residents in health initiatives tailored to community needs to have shown promise. We have seen promise in these. These initiatives often involve collaboration with local organizations to design effective health programs. So, Arkansas is at a pivotal moment implementing a variety of strategies aimed to improving health outcomes for its residents, particularly for those 65 and older. So we need to take a closer look at what Arkansas is currently doing to address these chronic diseases among its older population. One of the key organizations leading the charge is the Arkansas Department of Health. They have launched programs that focus on chronic disease management, which include education campaigns about diabetes, hypertension, heart disease. These initiatives raise awareness to promote healthier lifestyles amongst its residents. We have community partnerships that are also being done. Local community organizations play a vital role in these efforts. For example, the Arkansas Area Agency on Aging is working tirelessly to provide resources and support for older adults. These programs encourage physical activity, nutrition education, social engagement, all of which are critical for managing chronic diseases. And we also have telehealth programs that are emerging as transformative approaches in Arkansas, particularly during the COVID-19 pandemic. The state has expanded telehealth services to improve access to care for older adults, especially for those in rural areas. Programs like the Arkansas Center for Telehealth facilitates remote consultation among patients to connect with healthcare providers without the burden of travel. This is particularly beneficial for individuals like Ruth, who may struggle to make in-person appointments. Initiatives such as the Arkansas Chronic Disease Management Program focuses on integrating telehealth into the routine care. These programs not only provide medical consultations, but also incorporate lifestyle coaching and chronic disease education through a virtual platform. So we have to ask ourselves, if they're doing all of this, why is there a need for change? The state has recognized the urgent need to tackle chronic disease and is actively implementing these strategies. Organizations like the Arkansas Department of Health and local community groups are working diligently to promote healthier lifestyles and improve health outcomes for older adults. But while Arkansas is making these significant strides, we must continue to advocate for these vital resources and support systems to ensure the healthier future for our aging population. The state is ranked as 47 in healthcare of our nation's 50 states. We still have our work cut out for us. So, what's the solution? I am proposing that implementing a comprehensive disease management model supported by telehealth and by social services. The benefits of IDM, or integrated disease management models, are one, they don't just focus on medical treatments, but also the social determinants of health by integrating community resources. Let us imagine a healthcare system where our dear friend Ruth can consult with her doctor from the comfort of her home, receiving nutritional guidance through community programs, and have access to transportation assistance when needed. Of course, IDM is no new shiny penny by any means. Collaborative and coordinated cross-sector care has been all the rage and the goal for many years, but the problem often lies in the execution, the evaluation, and the longevity of these programs. On several different occasions, Arkansas has developed a collaborative team to address different issues. For example, my aunt, who has been a nurse for years, she's in her 70s, was a part of a collaborative team for maternal health at the prime of her career. But we're still battling with maternal health. Even now, the state of Arkansas is in a crisis. So we are seeing that after these issues are identified, a plan is created, but often the team who was on this team that collaborated, it dissipates. But by shifting the emphasis towards prevention with a different collaboration approach, by integrating social services, we can improve health outcomes, reduce healthcare costs, and enhance the quality of life for our older population. Similar approaches have been seen to have success in states such as Mississippi, Kentucky, Florida, and West Virginia. Components of these programs include care coordination, patient-centered care, telehealth integration, and community engagement. These components can be useful in the development and implementation of a similar model here in the great state of Arkansas. So now let's talk about how we can make this a reality. We can make this a reality by one, expanding telehealth services. We will need to advocate for policies that promote telehealth, especially in rural areas where access is limited. Two, we can do a community health worker initiative. Integrating community health workers into healthcare teams can provide culturally relevant education and support. And three, by addressing social determinants of health, transportation, nutrition, education, by collaborating with social services to create referral networks will ensure that older adults receive the necessary support they need in medical and social needs. This integration is critical because social determinants of health, like that access, nutritious food, safe housing, and reliable transportation, impact health outcomes. So I am proposing that we take a phased approach. Phase one, establishing foundations. Phase two, infrastructure development and pilot programs, and expansion and improvement in phase three. So here you're looking at phase one of this. So I would like to welcome you to phase one of our implementation strategy. This phase is critical as it sets the groundwork for all future efforts. Key actions is one, to build partnerships. We will need to identify and collaborate with key stakeholders, including local healthcare providers, community organizations, and social service agencies. These partnerships are essential for pooling resources and expertise. We would too need to conduct a needs assessment. We have to assess the specific health challenges faced by our older adults in our community. Understanding these will allow us to tailor our programs effectively. And then we will need to develop training programs. We will need to create a training curricula for healthcare staff and community health workers, facing and focusing on telehealth technology and integrated care principles. The estimated cost for the foundational phase is approximately $150,000, which when divided among the 65 and up population in Arkansas amounts to roughly 27 cents per person. While this may seem like a significant investment, think of it as laying the cornerstone for a healthier future. By investing in a strong foundation, we can ensure the health of in the success of our initiatives in the long run and create a long-lasting impact on the health and well-being of our older population. By establishing a strong partnership and understanding community needs, we are not just setting up programs, we are creating a sustainable model of care that will benefit our older populations for years to come. And of course, it just wouldn't benefit our older population. Anybody with a chronic disease will benefit from this program. So let's invest wisely in this phase to pave the way for transformative health outcomes. So now we have phase two, the development and pilot program. This phase is where our plan starts to take shape and becomes actionable. Telehealth infrastructure is set up. We will acquire the necessary technology and enhance broadband access to individuals in rural areas. Because the state of Arkansas is so rural, we will need to ensure that everybody has access to internet and Wi-Fi and all of the things that are necessary for telehealth to take form. And we will launch a pilot program in selected communities to test our integrated care model and gather valuable feedback. And then next, we will develop marketing materials and host informational sessions to educate older adults about the services available. The estimated cost for this phase is around $500,000, which when divided among the 65 and up population is roughly 90 cents per person. This includes technology acquisition, broadband expansion, and the community outreach efforts. While this is a sustainable and substantial investment, the benefits are clear. For every dollar spent on telehealth, study shows we can save approximately $4.93 in avoided healthcare costs, such as reduced hospital admissions. So, if we invest in an infrastructure and pilot program that is crucial for demonstrating the effectiveness of our integrated care model, and by doing so, this approach in a real world setting, we can refine our strategy and ensure they meet the needs of our community. This phase is not just about implementation, it's about proving that our vision for healthier lives is achievable. So now we have phase 3. As we enter in phase 3, we finally arrived at the expansion and continuous improvement of our program. This phase is where we scale our efforts and ensure its sustainability so that we could experience it as people that are young and in their youth as well. So first, we would have to develop a program evaluation. We will analyze data from the pilot program to assess health outcomes and participant satisfaction. This evaluation will guide our expansion efforts. Based on feedback, we will expand the program to additional communities, ensuring that older adults benefit from our integrated care model. And then we will develop a sustainable plan for ongoing funding and partnerships to maintain the program in the long term. The estimated cost for this phase is around $300,000, which when divided among our 65 and up population amounts to about 54 cents per person. This includes funding for program evaluation, expansion efforts, as well as developing sustainable strategies. While this is an ongoing investment, it is essential for ensuring that our initiative continues to thrive and adapt to the needs of our community. This phase represents a culmination of our efforts and the opportunity to make a lasting impact. By evaluating and expanding our programs, we can ensure that our integrated care model reaches many adults. Moreover, with a solid, sustainable plan in place, we can secure the future of these vital services, ensuring that our older population and others that are living with chronic disease receive the care that they need for years to come. So we know that we can't implement anything new without barriers. So we must acknowledge the barriers of implementing such program and strategies. One, we have limited financial resources. Fundings for telehealth infrastructures and community programs can be scarce, especially in a state with high poverty rates. This can hinder the development and sustainability of an essential health initiative. And then we have technological barriers. If you're anything like my parents, we are Apple users in my family, and my stepfather told me that he does not have an Apple ID. And we all know that everyone with an Apple device has an Apple ID. So we have to understand that older adults may lack access to the necessary technologies or even the skills to use it effectively. Without proper training and resources, they may struggle to engage with technology for telehealth services. And then there's the mere fact that they don't want to change. We can be comfortable in the fact of going to the doctor and seeing our physicians and providers. And some patients and providers may even be hesitant to adopt a new model of care, preferring traditional methods because they're more familiar with them. To address these challenges, integrating social services into our healthcare strategies can play a pivotal role. By collaborating with local organizations, we can secure funding to enhance telehealth structures and community programs. Social services can also provide critical support in bridging the technological gap. For example, they could facilitate a training session that enhances digital literacy amongst our older adults, ensuring they are comfortable with the use of telehealth services. Social services can help address the underlying social determinants of health that contribute to these barriers by connecting with older adults with resources for transportation, food security, and social support. We can create a more robust safety net that empowers them to take charge of their own health. Outreach efforts led by social services organizations can educate both the patients and providers about benefits of integrated care, fostering a culture that embraces change and innovation. This whole person, holistic approach ensures that we not only tackle the barriers of implementation, but also enhance the overall well-being of our older population, achieving that whole person care. So now it is a time where we all can play a part. Imagine if we just all took one small step towards advocating for a better healthcare access for our older population. Your role, whether it is volunteering at your local health organization or your nursing home, or supporting telehealth initiatives, or simply spreading awareness about the importance of addressing chronic disease, every action counts. So let's create a community where our older adults like Ruth can strive and not just survive. Envision a world where our older population in Arkansas lives healthier, happier lives, free from the burdens of preventable chronic diseases. As we move forward, let's remember that we have the power to change the narrative of chronic disease management. Together, we can build a healthier, more equitable future for all Arkansans. I would like to end with a quote. Quote, "To care for anyone else enough to make their problems one's own is ever the beginning of one's real life." A.C. Benson. Thank you all for your continuous time and support on this journey, and have a great evening.
Good evening and welcome. My name is Lynn Johnson-Reed, and I'd like to share with you my solution-focused capstone project entitled Reducing Black Maternal Mortality, Implementing Culturally Aligned Doulas in the Birthing Process. Before any solutions are investigated and even suggested, there must be a problem. Let me tell you what that problem is. As a licensed clinical mental health counselor, practicing for more than 20 years, I have noticed a recent increase in working with patients and families that have been affected by maternal and infant mortality, specifically Black mothers and Black families. The common themes I am hearing from the mothers and families is that their concerns of complications directed to medical providers are being dismissed, criticized, and even ignored. Often met with responses such as, "This is normal," "Maybe more sleep is needed," and even, "Are you using any drugs?" In a broadcast on NPR entitled Black Mothers Keep Dying After Giving Birth by Martin and Montague, over and over, Black mothers shared instances of medical providers who equated being African American with being poor, uneducated, non-compliant, and unworthy. According to the Black Maternal Health Caucus, Black women are 3 to 4 times more likely to die from pregnancy-related complications, and also twice as likely to lose an infant to premature death when compared to their white counterparts. Why is this happening? What are the solutions? That is what this presentation will introduce, a possible solution to one of the most significant disparities in United States healthcare: Black maternal mortality. Dr. Dawn Godbolt, health policy analyst at National Partnership for Women and Families, states Black women should not lose their lives or come close to it in an attempt to bring forth life. I agree. The Centers for Disease Control define maternity mortality as the death of a woman while pregnant or within 42 days of termination of pregnancy, but excludes those from accidental or incidental causes. As mentioned earlier, Black women are 3 to 4 times more likely to die from pregnancy-related complications to white women, and at least 2 to 3 times more likely than Asian and Hispanic women. This slide represents data collected from 2018 to 2021 by the National Center for Health Statistics, giving a clear visual of the disparities that do exist regarding race and maternal mortality. Not only do non-Hispanic Black women die at a higher rate than women from other groups, the significant number of deaths per year was much higher than other groups. Here we see the most recent data collected by the National Center for Health Statistics in 2022, showing a trend of decline in maternal deaths across all racial groups. But even in the decline, Black women continue to significantly account for the most maternal deaths by race. Although statistics and data offer concrete information, it is also imperative to put a face to this data. Meet Shamani Gibson and Amber Rose Isaac, both beautiful Black women that lost their lives due to being pregnant while Black. They are the faces of Black maternal mortality. The United States is one of the most dangerous places to give birth compared to other developed countries, and Black and brown birthing people are dying at a 3 to 4 times rate of their white counterparts. We need to address racial and gender bias in our medical systems by amplifying and listening to the lived experiences of people directly impacted by the maternal health crisis. This statement was shared by the team that created a film called Aftershock, which followed the families of Shamani and Amber. The film witnesses their 2 families becoming passionate activists in the maternal health space, seeking justice through legislation, medical accountability, community, and the power of art. Their work introduces a myriad of people, including a growing brotherhood of surviving Black fathers, along with the work of doulas, midwives, and physicians on the ground fighting for institutional reform. Through their collective journeys, the film brings the audience to the front lines of the growing birth justice movement that is demanding systematic change within our medical system and government. In both medical crises, dismissed concerns and implicit biases were reported. Aftershock premiered at the 2022 Sundance Film Festival and was awarded the Special Jury Award, Impact for Change. Aftershock was acquired out of Sundance by Disney's Onyx Collective and ABC News Studio and was released on Hulu in the US and Disney Plus worldwide on July 19, 2022. These types of issues within health systems can often lead to the health complications that are shown. Bowen et al. Suggests other factors that prevent women from receiving or seeking care during pregnancy and childbirth are related to health systems offering poor quality of care, including disrespect, mistreatment and abuse, insufficient numbers of and inadequately trained health workers, shortages of essential medical supplies, and the poor accountability of health systems. The World Health Organization emphasizes social determinants such as maternity care deserts also play a valid role in disparities in health equity. Income, access to education, race and ethnicity, harmful gender norms, and climate and humanitarian crises are all examples of social constructs that impact equity. So what does the literature say? Studies examining the impact of continuous support by doulas report significant reductions in cesarean births, instrumental vaginal births, the need for oxytocin augmentation, shortened duration of labor, higher newborn APGAR scores, and overall higher satisfaction by mothers with the birthing process. Another study completed by Namsen Rivers reported that in comparison to a group of women receiving standard care, a doula-paired group of women experienced significantly shorter periods of labor, less instances of instrumental assisted birth, and better APGAR scores at 1 minute postpartum. The doula mothers also experienced earlier onset of lactogenesis, which is the initiation of milk secretion, and were more likely to breastfeed their babies at 6 weeks. As you can see, positive outcomes because of doula care are not a new intervention, but very little promotion of this service has been shared. And if higher practices of implementation, doula care will improve overall maternal outcome, specifically the Black maternal experience. Now that we have been familiarized with some of the main reasons why disparities exist in maternal health, what are some of the suggested solutions found in the literature? The CDC has developed a guide for pregnant women and families, healthcare providers, hospitals and healthcare systems, and states and communities on how they can do their part in the fight against racial disparities in maternal health. Pregnant women and their families should talk to healthcare providers if anything doesn't feel right or is concerning. Know and seek immediate care if experiencing severe headache, extreme swelling of hands or feet, trouble breathing, heavy vaginal bleeding or discharge, and overwhelming tiredness. Patients must share with their care team recent pregnancy history during each medical care visit for up to 1 year after delivery, and connect with healthcare and social support systems before, during, and after pregnancy. Patients should also consider non-traditional birthing options, such as adding the assistance of a doula to their personal care team. Some may ask, what is a doula? A doula is a trained birth worker who provides families with emotional and physical support, including non-clinical and information support through pregnancy, childbirth, and postpartum. What are the benefits of using a doula? Doula services have been shown to positively impact the social determinants of health, support birthing equity, and decrease existing health and racial disparities. Doulas can promote birth equity. What is birth equity? Birth equity is a call for new pathways of inquiry with expanded and novel methodologies, culturally respectful standards for quality of care, and a commitment to inclusion and diversity as critical elements for transformative change. Lawmakers and advocates are recognizing doula care as a promising, cost-effective tool to improve maternal health outcomes and reduce racial disparities. Concurring is the American College of Obstetrics and Gynecologists, as well as the Society for Maternal Fetal Medicine, who reported that the continuous presence of the doula during pregnancy is one of the most effective tools to improve labor and delivery outcomes. So how much does it cost to use a doula? Despite the positive impact doulas can have and their growing popularity, not everyone can afford the access to a doula because of cost, absence of coverage through their insurance carriers, and the deficiency of trained doulas to service women in need. Doula services can cost upwards of $1,500 per birth as an out-of-pocket option, while several states now covering doula care under their Medicaid programs. Which leads me to the next question. Is doula care covered under insurance? As of November 2022, there are now more than half of all states that are either actively providing Medicaid coverage for doula care, in the process of implementing such coverage, or that are taking some statewide action related to or adjacent to Medicaid coverage for doula care. Yet coverage for doula care in private health insurance plans remains non-existent. To advance health equity in the maternal mortality rate, doula care must be considered as an essential service for mothers, especially mothers that are victim to the statistical rate of mortality. Initiatives such as the National Health Law Program's Doula Medicaid project, which seeks to improve health outcomes and address inequities in maternal health by ensuring that all pregnant, postpartum, and post-pregnancy people who want to access a doula can have one, are a must for the future and health of Black mothers and their babies. So how can you become a doula? DONA International's primary function is to provide excellent doula education and certification to a diverse population of doulas worldwide. Doulas of North America, DONA, is an international organization that promotes the highest quality of perinatal support for pregnant, birthing, and postpartum people and their families by setting the standards for doula education and training and by advocating the research-based benefits of doula care. Certification to become a doula is approximately 24 hours of education and costs about $700. So what are the implications for the future of doula care? To accomplish ongoing positive change in the Black maternal mortality rate, microscopic examinations will need to be required in every part of our healthcare and medical processes that interact with a pregnant person pre-delivery, during labor and delivery, and post-delivery. Doulas have always been used in the Black community, sometimes under the name of a birth worker, a midwife, or just an elder in the community that had non-clinical experience in pregnancy care. Doulas can step into the role that allows them to advocate for a mother at her most vulnerable time. Doulas can be the speaker in the pregnant woman's silent whisper when she feels that something within her pregnancy may be off. Educating on the warning signs of potential pregnancy dangers, such as severe headaches, edema, breathing distress, irregular vaginal bleeding or discharge, and the extreme fatigue could be the bridge to life-saving approaches. A call to action is a must for all areas of healthcare, including research, preventative services, data collection, and health equity training in the fight against racial disparities in maternal mortality. Our government leaders need to be on board with this critical and unequitable area of healthcare. How can this be done? Education, sharing resources such as these organizations listed here, as well as sharing with Black women and even men the importance of becoming a doula to culturally align with the women that represent the highest racial group that is impacted by this deadly crisis. Thank you from the bottom of my heart for your attention and your curiosity to this very critical subject. I would like to thank my Lord and Savior above. I would also like to express my sincere gratitude to the entire Morehouse School DHA facility, specifically Program Director Dr. Raynetta Waldrop and Assistant Professor Dr. Dorothy Boldrick. I would also like to thank my Capstone faculty advisor, Dr. Angela Wimes, and my subject matter expert, Dr. Cynthia Wesley. Finally, all the many professionals that allow me to interview them, consult with them, and learn from them. Debbie Nash and Valencia Jeffcoat, thank you for being instrumental in this completion of this doctoral program, as well as my personal doctoral journey. I am also extremely thankful to my wonderful cohort. We are the inaugural DHA cohort here at Morehouse School of Medicine. And although we did lose a few along the way, we stuck through the challenges and enjoyed each other's personal and professional accomplishments, and I would not have wanted another group of professionals to trek this journey with me. I would also love to recognize my beautiful family and friends for all of their support and encouragement, and sometimes the needed distractions as I completed this 3-year journey. Finally, I dedicate this capstone to the countless numbers of mothers and babies that have succumbed to the maternal mortality rate, with a special recognition to the Black and brown mothers and babies that represent the disparate number compared to their white counterparts. This work is for you and your families that miss you so very much. Thank you.
All righty. Thank you so much, Capri, Leah, and Lynn, for the engaging presentations of your solution-focused capstone. I am going to facilitate us taking questions at this time. If anybody has any questions at this time for Capri, Lynn, or Leah, please place them in the chat and we will read them out loud. All right, I don't think I see any. Give me one moment. You all are getting a lot of congratulations. You're getting congratulations from your fellow cohort members. Yes, great job. Awesome presentation, ladies. Oh, I think we do have a question for Lynn. What additional non-clinical roles or positions do you anticipate could play a significant role in reducing maternal mortality rates amongst Black women and promoting improved health outcomes? Lynn?
Great question. Families need to advocate. Families need to be cognizant of what's going around their loved ones as they go through the pregnancy journey, as they go through the labor and delivery journey, and the postpartum journey. Families, loved ones need to really be that sounding board, advocate when something's not right, and just being there to support your loved one. And it's so doable, and I've seen it work. I've seen it within my own family. So I would really recommend families being very active and proactive in their loved one's pregnancy process.
Fabulous answer. Thank you, Lynn. Do we have any other questions for the ladies from the audience? I don't see anything in the chat on my end. Okay, going once. Going twice. Alrighty, well, thank you all so much for your engagement. I'm going to open the floor up to Dr. Boldrick.
Good evening, and congratulations to all of our scholars. As we bring our capstone presentation to a close, I want to take a moment to acknowledge the dedication, the hard work, and the rigor that have brought our scholars to this point. Each of you has spent countless hours researching, writing, rewriting, analyzing, and developing solutions to some of the most challenging issues in healthcare today. Your work reflects what it means to be a leader in health administration, combining evidence-based practices with innovative strategies to improve health outcomes for all. Congratulations to each of you on reaching this significant milestone. We are incredibly proud of your accomplishments. My heart is full because with each presentation, I just see the culmination of amazing scholarly work and the impact that you will have on healthcare. Well, this concludes another evening of outstanding achievement from our scholars. I would like to thank all of you for your attendance, for your support and continued support of our scholars and our Doctor of Health Administration program. And I wish all of you that you will have a great evening. And thank you so much for joining us. Good night.